Today, healthcare is not like any other industry. It's focused about saving life and improving the quality of the life of the patients. And to do that, you have to have a partner, whether it's local or outside, with different government, different individual and different entities. It's about providing better care, better transactional research, and better outcome. It's about what really matters to the patients.
The healthcare sector indeed is very complex. In science we call it the trust sector. The key takeaway would be to always have empirical data on where the organization stands in terms of trust and reputation.
There's always this like dance, I guess you could call it, between the devil and the angels. The AMC's standing for ethical probity and academic independence, and the commercial organisations often perceived as being self-seeking and money orientated. And the truth is that they have to find a way of collaborating in the middle of that space, because they both need each other in order to succeed. The AMCs, in order to have real scale impact and to fund the studies that they want to do, will need to collaborate with commercial organisations.
We're well over 3 trillion in debt. There are cuts going on everywhere because they have to be, I guess. We've got to balance the book somehow. But if we prune the vine for academia, you won't ever regrow it. If you chop it off at the roots, you won't be able to plant it and nurture it again. The narrative you'd hear in Britain is the system's falling over, care is rubbish. And I'm not going to be an apologist for NHS care. There are lots of bits where it could be dramatically improved. But it's not as rubbish as the general perception would think that it is, and it's certainly very, very good value for money. We were talking in the meeting just now, the fact that 18% of GDP in America is spent on healthcare. In Britain it's 11%. But our outcomes across pretty much everything are as good, if not better, and efficacy and efficiency are also better.
Who are going to be the patients of the future? It's Gen Z, right? In 4 years' time, at least in the US, Gen Z is going to be 30% of the workforce. If you make it hard for them to book an appointment, they're just going to go and seek treatment on AI. They are impatient. They will not tolerate a poor experience on what they think should be the fundamentals and basics. They're more likely to turn to AI. So we have to start to think about the needs of this group if we're going to be able to stay competitive.
There's a lot of misinformation out there, many different sources of data that can be approached by consumers or academics alike, and having sources of authority that are credible, that reach patients and consumers, which they can trust with confidence, that's a huge potential benefit and a huge impact that people can have well beyond their academic disciplines.
Historically, AMCs Johns Hopkins or Oxford University or KFSH in Saudi Arabia, they would not really have considered themselves brands. They wouldn't consider themselves in any way anything to do with the branding industry. But it is quite obvious when you look at the reputation they have, the affinity of stakeholders, they fulfill all of the requirements of being brands. And the point of a brand is to reassure audiences so that their preferences are to do things with them, to spend money, to be in the hospital, to collaborate or whatever it might be. And really what they need to do is to understand how their brands can enhance their commercial position, and we are here to help them do that.